It's time for a chat with Dr. Amber McKnight from Simcoe Optometric Clinic on Colburn Street in Simcoe. And today, Dr. McKnight, if I may get serious, I want to talk about. I first want to share a little story. I was at a ball game on the weekend, and it was really cool. They were doing the birthdays in like the fifth inning, and we were sitting probably 30, 40 rows up, I guess. And the last birthday they said was a lady whose name was Ethel, and she was turning 100 years old, and she was
Oh, wow.
sitting just the next section over from us. And then, there I am with my glasses trying to get a look. She's not wearing any glasses, and she sees the ball game perfectly, and she's 100 years old. Come on, we got to do better, right?
Way to go, Ethel. That's amazing.
I
Yeah.
know, that's what I thought too, and I was really happy for her. Big smile, and everybody was chanting her name. I thought, wow, that's really cool. Like people still appreciate, have that feeling for folks. But
I know.
what kind of got me was like, how did she sustain such great eye care over all the years? I mean, one of the things I want to talk about today was just cause and effect. Like, if you are a diabetic, you got to be careful with your eyes. If you have cancer, like, there's so many secondaries, and I want to talk a bit about those today and what you see. Okay.
Yeah. Yeah. No, we bring up a great point. Most of us, if we've been lucky enough to not need glasses as a younger person, usually by 40 for sure, and if not 40 by 50, almost all of us are wearing glasses for some reason. Some of that is just aging of the lens inside the eye. So in Ethel's case, I don't know, I'm just sort of guessing, but I would imagine she's probably had cataract surgery and she's probably had some of her sight restored a little bit that way. So which is amazing. Most of the time with cataract surgery afterwards, your vision is better than it has been for the last 10 or 20 years before. And a lot of times they can add the prescription into the lens that goes inside the eye, so you can get away without glasses. So which is amazing. So pretty exciting for people. Like, the downside is you have cataracts and need eye surgery, but the upside is sometimes really improved vision afterwards. But you're definitely right. There's a huge connection between sort of systemic problems, eye health issues that are linked to other conditions in the body. So diabetes is a big one, and that's a direct sort of connection. The little tiny blood vessels at the back of your eye can be affected by chronically uncontrolled blood sugar. So sometimes even with type 2, I'm having people being diagnosed in the office with type 2 diabetes. They weren't even aware that they had a problem, but we can see changes in the eye. So, I get asked a lot, what can I do to keep my eyes healthy? And it's a lot of the same advice I would give you to keep the rest of your body healthy, keep your blood vessels healthy and your nerves healthy. So, moderate exercise, low stress, lots of sleep, well, 8 hours of sleep a night if you can. Diet rich in dark leafy green vegetables, not a lot of saturated trans fats. Get moving. Like I said, the exercise is a big one, not smoking. But for sure, if you're dealing with other chronic health issues, sometimes it's the health condition that affects the eye. Sometimes it's the medications and the treatments that you're taking
Yes.
for other health conditions that affect your eyes. So, there's a big list of things. Anybody that's on anti-inflammatory steroids for autoimmune issues, you're right. If you've had chemo or radiation, high blood pressure medications can affect the eye. There's a big list of things. So if you're what big thing is, if you come for your eye appointment, bring a list of your medications with you, which is always helpful.
And you were saying off air, we were talking a little bit about blood flow, and I didn't realize how important it is to the eye or how much of it is to the eyes, eh? Can you
Yeah.
explain that?
Yeah, so your retina and the tissues underneath the retina are some of the most like the blood vessels there are more dense than anywhere else in your body. So we think of our kidneys as being really dense with blood vessels. So conditions that affect tiny blood vessels in the body. So diabetes is the big one.
Okay.
Will damage the structures at the back of your eye, and that's not reversible. But it is visible to me when you're here for your eye exam. I can see a lot of those little blood vessels and see damage starting in the blood vessels, even though your vision might be fine. So that's why smoking can affect your eyes so drastically as well, because it affects the blood flow to the tissues at the back.
I didn't know that. I mean, and they talk about just being, like you said, the healthy diet is critical for the proper vitamins as well that your eyes need, which I didn't really realize. Like there was a whole list here that I saw, and I was just like, okay, that makes sense. Like once you start, just taking a minute to think about it, it all adds up. You need to be that. And going back to the Ethel story, I mean, it's so cool that in 100 years, right, all she's seen with her eyes. Like
Hmm.
just that aspect of it. When I was thinking about this conversation today, I was just like, man, like, she's seen it all literally. And I think that's the part why it's so important to remind people to protect their eyes and do all these things that they need to do to make it uh, preventable. And the other aspect that I want to touch on, because I think June is what is June for vision? I think it's
Oh,
we were talking
eye injury prevention month, I
right.
believe, awareness month. So, yeah, I'm always surprised the number of eye injury calls that we get on a pretty regular basis. So for sure, if you do get anything in your eye or a minor eye injury and you want it checked out, sometimes our first thought is to go to the emergency room. But you can definitely call us here at the clinic. We get you in the same day. Can manage what's going on for you, remove things out of the eye, prescribe antibiotics or medications for the eye, put bandages on the eye. So lots of things we can do here. But yeah, eye injury prevention month. So again, I always just encourage people to kind of be aware of you're going to do an activity where there's a possibility that something might get in your eye or you could get hit with something in the eye. Sunglasses or ideally safety glasses. Something that people are doing a lot of this time of year and definitely up there in the top couple things people come in with eye injuries is gardening and yard work, outdoor work. Yeah, yeah. But things are you're weed whacking, you're trimming,
Yeah.
you're bending over in the garden to grab, pull out a plant, and there's a stick kind of in the way that you don't see. So um, all the time, people are coming in with something in their eye that they've gotten when they've been outside, whether it's a piece of a plant or a scratch from a thorn or a piece of a bug wing. So
Yeah.
it's amazing. Safety glasses and sunglasses aren't going to prevent all of those things from happening, but they prevent the more major injuries. So if you're outside, always a good idea to wear some sort of eye protection.
And that's a really good point because I mean obviously there's so much you can do, but I mean there's probably injuries to the eye too that you need to go to the hospital directly. But
Yeah, yeah. I
when
would
you were
if
talking,
I was gonna say if you
go
can't
ahead.
open your eye or it was major force, major trauma for sure. Don't call us, but that I think I have something in there or pieces of metal from grinding or welding. And if we
Yes.
see you and we think, oh, you need to go see the ophthalmologist or the hospital for this, we'll get you set up pretty quickly to see someone. So, but yeah, you're
Just
right. You gotta go
just a
where you
quick
think.
follow up too. Should you I mean and I'm notorious for doing it. If I don't have my glasses on, I'm outside working and something gets my first thing I do is rub it instead of flushing it out. And let's talk just quickly about that. That get some water there, isn't it, to flush it out as quickly as you
Yeah,
can?
yep. Flush it out. And you're right. Your first instinct is maybe to rub it. Try not to rub it if you can. You don't want to push anything in further than you need to. Ideally, you probably don't have an eye wash station in your garage. That's ideal, a ball of sterile saline or something. But yeah,
Uh,
even rinsing it with water, a stream of water, continuous water, or fill a cup up with water and tilt it back against your head and rinse your eye around. Um, any sort of chemical burn. If you get something sprayed
yeah.
in your eye, for sure, rinse it with water for really until you can get seen. So, even 10 minutes is not too long to be rinsing your eye out if you get some sort of chemical in it. But yeah, rinsing it's always good. You can leave it closed and try not to blink, kind of keep it shut until you can go in and get it checked out. But yeah, try not to rub, try not to poke around with anything, try not to move anything yourself out of your eye if you can see it there and you're tempted to kind of pick it out. Don't do that. Go, leave it up to the pros. We'll take care of you.
Professionals. And this is my last summer question, and then I will let you go play for the summer. Swimming goggles. We don't really talk too much about it, but yeah, I know that you guys do prescription ones and all that as well. But I mean, just I always see people that never fit them right on their kids. You know what I mean? Like they're always, they don't get them to seal properly. I guess. Any advice on that?
Yeah, so for swimming goggles, you're right. Any sort of swimming goggle, sports goggle, even sunglasses. I think we can't underappreciate sort of the aspects you get with a professional fitting. So we do sell swimming goggles here, prescription and non-prescription, various sort of styles and fits. Same with things like sports glasses for either hockey or baseball, summer sports, ones that fit like sunglasses or ones that fit more like goggles. So, but yeah, if you've got a pair of swim goggles that you want to come in and have one of our optical staff make sure they're fitting well. With with buying them, a lot of them over the shelf, I think it's smart if you can try them on in the store, getting them to fit properly. We all of our faces are different shapes, so there are different styles available. And prescription for sure, even small amounts of prescription can make a huge difference for people that wear glasses underwater. They're a lot of them are sort of semi already finished, so they're not as expensive as maybe like a separate pair of prescription glasses. So you can get a pair of swim goggles with prescription in them for a pretty reasonable price for your kids or for yourself.
Perfect. Dr. Amber McKnight, Simcoe Optometric Clinic, Colburn Street. Have a great summer. Thanks for doing this, and I look forward to
Yeah.
catching up with you in the fall.
Thanks, Dave. You too. Enjoy your summer.